This Docs on Call is brought to you by Excel's Blue Cross Blue Shield. I'm joined today by Dr. Micah Lissy, a sports orthopedic surgeon with UHS. We're here at Union Endicott High School to talk about bicep tendon ruptures. Now, how does that happen?
Bicep tendon ruptures, the biceps can be torn either at the very bottom or the very top, so at the elbow or at the shoulder. And in the elbow, it's commonly torn when your arm is straightening even while you're trying to bend your elbow, particularly if you were trying to lift up something that was heavier than you thought it was. So you're lifting up, but then your arm straightened instead of that, and that's how you tend to tear your biceps tendon.
Well, what does it look like when this happens to you?
First of all, you hear a loud pop, and it feels like a little explosion inside your elbow. A couple things happen. Once that biceps will sort of ball up, and you get what's called a Popeye deformity, so the whole thing will translate up. You have a little gap down here where there isn't a tendon anymore. There's bruising in your elbow and some swelling in your elbow, and all those things taken together mean that you tore your biceps tendon.
I mean, it doesn't sound very good. How can someone treat this?
They're not very common, but when they do happen, if you don't repair them, you have more than 50% loss of strength, particularly for bending your elbow and turning your palm up. And so we tend to repair these, and we try and get them into the operating room to repair them back within 4 weeks' time.
If it happens, is there any way to get back to full strength?
With the surgical repair.
With the surgical repair?
And then a lot of rehab.
All right. Dr. Micah Lissy with UHS, thank you for joining us here today. If you have any questions about a bicep tendon rupture, you can visit our website at wbng.com or call 584-7362, 584-7-DOC.